Hello, my name is Brad Tice. I am a pharmacist, a doctor of pharmacy, and today I'm going to talk to you about a concept that can really change your life, can actually save your life, and has saved people's lives. It's a concept called pharmacogenomics. You've probably never heard of it before. It's this big old long word, pharmacogenomics, right? Long, hopefully you never have to say it again. Let's just refer to it as PGX for short, PGX. Or maybe an even simpler way to remember is ExactMeds. You can check it out at ExactMeds.com. That's a test that we do. It's a simple test like right here in this box you get in the mail. It's just a buccal cheek swab and no blood or finger stick or anything like that. So very easy to do, important information to have for the rest of your life. And I'll tell you kind of a little bit of why. Right? Because we all hear stories about how people respond to medications differently. 82% of people are on a medication. Oftentimes 50% of medications are ineffective or minimally effective. And we're learning more and more that that is because of a person's genetics, what's in their DNA and how they are going to respond to medications specifically to themselves as individuals. I like to point out, we see all the differences that we all have on the outside, hair color, eye color, facial tone, skin color. Now we understand those differences exist on the inside in a way that is really meaningful to how we respond to medications. 91 to 99% of us have some sort of variation that's going to affect how we respond to medications. And when we do this test, it applies to all known evidence today across all medications, not just a drug that you're considering. And it's a test that takes a little bit of time, probably at least 5 to 10 days to get done. It's not something you can just get done when you need it. So it's best to have the information ahead of time. But we'll talk about when to test and kind of what the levels of evidence and studies are showing today, right? So what we're really talking about is this concept where, again, PGX, pharmacogenomics, ExactMeds, we can now understand, are you a poor metabolizer, an intermediate metabolizer, a normal metabolizer, or an ultra-rapid metabolizer? And it's going to be different for different medications. And there's based upon how those medications are metabolized in your body. So, just as one simple example, it doesn't work this way for every medication, but if you are a poor metabolizer, then that drug is going to stay in your body longer than was measured in the clinical trial when that the dosing information was based on, because that treats everybody the same. And for many drugs, they hadn't done these studies when they were bringing these drugs to market. So if you're a poor metabolizer for some drugs and it's going to stay in your body longer, your body's going to be exposed to it longer, and you can have more side effects. Toxicities could build up. That's just one example, but there are several variations of that. That's also why you don't see this direct to consumer as much. Really need to have a medical provider, a pharmacist involved who's the expert on medications to work with you and your doctors to get this applied correctly. Let's just go over some examples to help you understand and relate to this a little bit more. So one example that I think we've all heard of is codeine. We've all heard of codeine, very common drug, very old drug. That's why there really isn't even a brand name anymore. We just talk about it as codeine, or you might use Tylenol with codeine. That medication actually has a black box warning. The black box warning is the highest contraindication that the FDA can put on a drug, of warning the prescribers, warning the healthcare professionals of when it should be used and should not be used. This drug was actually said to not use it in those under 18, especially under 12, because of their metabolizer status. And whereas if we know this metabolizer status, we can dose it and use it appropriately. But there have been children who have died because of taking this drug and the way they metabolize it. And then even if, it's not as significant of a consequence of death, obviously, but you can still have suboptimal pain relief from the medication. Another drug for pain relief, very commonly used, is called tramadol. The brand name is Ultram, and it's used for pain. It also has a black box warning from the Food and Drug Administration because serious life-threatening or fatal respiratory depression may occur. It's the same sort of issue, again, around metabolizer status, and can it be impacted by, the effectiveness can also be impacted. So two very common examples. The one that first caught my attention about 10 years ago is a little more than that is clopidogrel. Its brand name is Plavix. It's used for blood clots, stroke, and chest pain. And that drug has a black box warning from the Food and Drug Administration that says clopidogrel's antiplatelet activity is dependent on the conversion to an active metabolite. And that ability to convert it is based upon your genetics. So I like to give the example simply using my hand. This drug comes into your body like this, and your body has to do something to what comes into your body to turn it into its active form. Between 12 and 42% of people, depending on your ethnicity, can't convert that drug to its active form. And so you have to even question what good is that drug. This drug was the third highest selling drug in the world before it converted to was generic status, and it's used for secondary stroke prevention and acute coronary syndrome. I mean, significant, treatments here that are not being as effective. And we could simply know a person's metabolizer status and use medications a lot more appropriately. Okay, another drug you probably heard of, amitriptyline. It's used to treat depression and sometimes nerve pain. The brand name is Elavil. It has a black box warning that talks about increased risk of suicidal thinking. Now, this one does not tie specifically back to the genetics and the metabolism like clopidogrel and codeine and tramadol, but up to 30% of the general population may experience therapy failure or serious adverse events because of how they metabolize the medication. And so let's get this test done for everybody so that you know how you're going to respond to medications, and they're going to work, and we're going to minimize the number of side effects and consequences from taking medications. Citalopram, the drug for brand name is Celexa for depression. Some of the best levels of evidence are in the antidepressants and anti-anxiety agents for the use of pharmacogenomics. In this case, about 8% of the general population may experience therapy failure or serious adverse events. So those are some common drugs, but there are over 120 drugs on the Food and Drug Administration website. They publish the tables of genetic variants and for safety and clinical impact. And they say even there that this is just the start. There's also an organization called CPIC, the Clinical Pharmacogenetic Implementation Consortium, that is a group of over 600 professionals who have signed on and worked together to review the evidence that is out there and develop clinical treatment guidelines. And they've developed these guidelines, over 23 guidelines that they've developed and are working on to get this science put into clinical practice. Very common categories, many medications. We now know, and we've got to get this used and get people understanding this and knowing how their lives could be improved by applying this into their lives. Let's look at some of the studies that have been published, because I think over the last few years, we've really made significant advancements in the number of studies that have been done to really show the benefit. This is one study actually done by our company, RX Genomics, where it was validated by an external third party. It demonstrated, they did the measurement, showed over $6,200 in total cost avoidance per person who was tested in the first 12 months. That's saving on medical costs of hospitalizations and emergency rooms and visits and doctor's visits, getting people off of medications they don't need to be on and on the right medications. So really significant savings in 12 months. And that's also one of the benefits of this test. We're changing medications. It's not like we're having to get somebody to change a behavior. It can be hard to adopt. This is a simple, let's go from drug A to drug B, let's change the dose and get people treated more effectively. All right, this is a study done in Kentucky of a group of over almost 5,300 people. and they saved $37 million in 32 months, over $218 per member per month in savings in a group, a very large group, over 5,000 people in this study, $7,000 reduction in total medical costs. Now, one question we ask sometimes is, who should be tested? Should we test people who are on a medication today or are considering a medication where there's known pharmacogenomic risk? Or should we test everybody and have everybody have the information for when they're going to need it? Because it does take, at least 5 to 10 days to go through the process of getting the sample, getting it processed, getting the review done. Well, there was a study, this is called preemptive testing, when we test people before that they're on the medication so they have the information. This is called the PREPARE study, preemptive testing. They looked at almost 7,000 people for 36 months, and they found a 30% reduction in adverse drug reactions. Now, how significant are adverse drug reactions? You would be surprised to know that adverse drug reactions and events are the 4th leading cause of death in the United States. They are the #1 cause of emergency room visits for the elderly. So it's significant. The challenge is it's not like one disease that happens that we can attribute them to, but they happen intermittently or sporadically, and they don't get all bundled together. And so when you put them all together, it's a big problem that is really getting under addressed, that we can make a lot of benefit from testing and getting people knowing this information and applying it. We talked about amitriptyline, and we talked about citalopram, those antidepressant drugs. Well, some of the best levels of evidence are in those drugs. This is one study on mood anxiety disorder patients. This was about 817 people compared to over 2,700 people that were similar to them. And over 6 months, they had 40% fewer ER visits, 58% fewer hospitalizations, over $1,200 reduction in total costs. Again, significant. This is a study of antidepressants and antipsychotics medications, people using them. Over 2,000 patients with almost 11,000 control patients. They saved over $1,000 in medication expenditures alone, and 70% of the savings were non-central nervous system medications, meaning probably not specific to their antidepressant or antipsychotic use. Like I said, this test, we test for everything because it's more cost effective to test once and get people all the information they need to use in the future. All right, and then 96 anxiety and depression patients, they had 2 times, the people who were not tested had 2 times the outpatient healthcare visits, 3 times the medical absence days, and 4 times the disability claims. They had an additional almost $5,200 in savings in 12 months in the group that was not tested. So what does this mean for you as an individual, for how you're going to feel? Is it going to make you better? I mean, obviously you would think it's going to make you better, but what are people saying once they've had the test done? Here are some testimonials that I thought would be helpful. From a parent's perspective, it is the worst thing to see your kid hopeless and not being able to get through putting his pants on or his shoes on. In my view and my wife's view, we believe that PGX testing probably saved his life. I mean, you don't get much better than that as far as a testimony. The parents believe it made such a difference in their child's life. We know who this is now, and you can hear the testimonial personally on our website, ExactMeds.com. He's a fully functioning adult now, getting married, leading a good life. But they believe this test saved their child's life. This is Jake here. A bad reaction to a common prescribed pain medication almost put me in the hospital. Now I know exactly what will work for me in the future. I said, you have this information for a lifetime. It's important that you store the results, or someone like us stores the results for you in a way that's able to refer back to them in the future. Colson here, ExactMeds is exactly what I needed when I needed it. For years, I struggled to manage the side effects associated with my medications. I was confused, overwhelmed, feeling like my body was broken. There are so many people who feel confused and overwhelmed when it comes to using medications, this can provide a lot more clarity and peace of mind. Dorothy, without this test, I would still be struggling to find the right combination to get my high blood pressure under control while furthering the damage being done to my heart, which would ultimately be damaging to my quality of life. Didn't fit it on the page here, but what Dorothy was really focused on was spending more time with her grandchildren and having a longer life with a good quality of life. Now she feels confident that she's going to have that. And what are providers saying? What are doctors saying? Why aren't you seeing more of this done in doctors' offices today? Well, here's 3 testimonials from providers specifically. This doctor is a medical director. I now consider it unethical not to test every one of our members. BB is a pharmacist. This information is incredibly beneficial and may help identify areas that could be addressed with a simple change of a medication. And Dr. JC, who's at a university hospital, the test was directly responsible for providing what I believe was life-saving information. So, some of this science is new. Some of it was not taught when a lot of healthcare professionals were in their formal training at the universities. So it has to make its way into practice. There are actually studies that show that it takes 12 to 17 years to get treatment guidelines fully adopted. So that can be a slow process of people and practitioners moving from what they're comfortable with to applying and understanding and really using the new science correctly. So we're really trying to help people understand this because we believe and we see every day how much of a difference that this can make in people's lives and in healthcare, to help people feel better, to help people have the peace of mind and knowing they're on the right medications and they're using them the right way and they're having the best results from using those medications. So this is just the start and introduction, and we're going to make more videos, YouTube videos, so that we can help you understand and get the word out. Share it with your friends, ExactMeds.com, and we'll just hopefully can really make an impact in your life and those of your loved ones, whether those are parents, whether those are children, and really get this information known and adopted by more people.